Welcome to the Deep Dive. Today, we're plunging into something really fascinating, a shift in how we view cancer. For a long time, the focus was mainly on the tumor cells themselves, these rogue cells multiplying like crazy because of genetic changes. But what if that's only part of the story? What if the real key, especially for understanding how cancer becomes dangerous, isn't just in the tumor, but all around it?
That's precisely it. We're looking beyond the tumor cells to their whole neighborhood, if you will. We call it the stromal tumor environment, or STE, and it's turning out to be incredibly important, maybe even decisive.
Right, the neighborhood, I like that. And we're digging into this using a really insightful review article that just came out, 2025, in the International Journal of Dermatology. It really focuses on how this STE impacts skin cancer, and specifically melanoma, which, well, we all know can be very serious.
Exactly. So our mission today really is to unpack this STE. What is it? How does it actually, help melanoma progress? We'll also touch on why diagnosing melanoma is still, frankly, quite challenging. And then we'll get into this promising new imaging technology. The paper discusses something that might let us see what the STE is doing, and maybe, just maybe, change how we detect skin cancer much earlier.
Consider this your shortcut to getting up to speed on these cutting-edge ideas. Okay, so let's start with a bit of history. Because the paper rightly points out, this idea isn't brand new, but maybe its significance is only now hitting home. They mentioned Dr. Folkman's work from the 70s.
Yes, Folkman. Absolutely foundational. He showed something quite remarkable back then. Basically, a tiny clump of cancer cells, like super small, maybe only 1 to 2 cubic millimeters.
Like a pinhead.
Yeah, about that size. It just couldn't grow any larger unless it managed to get new blood vessels built towards it. That process, neoangiogenesis, was essential.
So without the surrounding environment actively helping out, building those supply lines, the tumor was just stuck, dormant almost.
Pretty much. It showed the environment, the STE, wasn't just passive scaffolding. It had to actively participate for the tumor to really take off. It's the support system, and it's a prerequisite for significant growth.
Okay, so let's define this STE more clearly. It's not just empty space, right? The paper calls it a highly organized, dynamic ecosystem. What does that actually look like?
It's bustling, really. It's this whole community surrounding the tumor cells. You've got immune cells, and interestingly, some might be fighting the cancer, but others are actually co-opted to help it. Then there are fibroblasts, kind of the builders of the tissue structure, endothelial cells forming blood vessels, parasites helping those vessels, even fat cells and adipocytes. And they're all living within this sort of rebuilt framework, the extracellular matrix, or ECM. It gets remodeled.
And it sounds like there's a lot of crosstalk happening. It's not a quiet place.
Definitely not. The STE is involved right from the start, in initiation, and it's critical all the way through progression. It helps tumor cells survive, it helps them break away, move, invade, and this happens through really complex back and forth communication between the tumor cells and all these other STE components. They're constantly influencing each other.
So how does this actually drive progression? It sounds like more than just allowing growth, it's actively pushing it.
It is. The paper really stresses this point. Cancer progression isn't just about the tumor cells collecting more genetic mutations, though that's, obviously important. It's this convergence, this coming together of those genetic changes and major shifts happening in the STE at the same time.
Like what kind of shifts?
Well, the ECM gets remodeled, sometimes becoming like a highway for cancer cells to move along. The way cells use energy, their metabolism can change. And crucially, the STE helps the tumor evade the immune system, either hiding from it or even manipulating. All these things together speed up tumor growth and make the tumor more diverse, more heterogeneous, which makes it harder to treat.
And there are specific molecules and cells that are like the key actors in this drama.
Oh, absolutely. Lots of them. The paper mentions various growth factors like VEGF, which stimulates blood vessel growth, cytokines for cell signaling, especially immune signaling. Then you have enzymes like matrix metalloproteases, MMPs, which act like molecular scissors, cutting through the ECM to make paths. And specific cell types get highlighted too, like cancer-associated fibroblasts or CAFs, and tumor-associated macrophages, TAMs.
And these aren't just bystanders.
No, they're often reprogrammed by the tumor. They end up creating this microenvironment that actively supports the tumor's growth, its invasion, its spread. They become collaborators, essentially.
The paper also mentions just briefly that we have tried to peek into this STE using existing imaging methods.
Yeah, we have things like MRI, PET scans, optical imaging, ultrasound. They all give us different pieces of the puzzle, different views on the STE's composition or how it's behaving. But getting a really clear picture of the molecular action, especially in a living patient in vivo, that's been the tough part.
Which brings us to why skin cancer, and melanoma in particular, is such a good model for studying this, according to the paper.
Right, it's all about accessibility. Because it starts on the skin, you can actually see it, track it. Researchers can easily observe lesions, biopsy them at different stages. It offers this unique window into how the tumor and its environment evolve together.
And the paper lays out that typical progression pathway.
Yeah, from a normal mole, a common nevus, CN, potentially to an atypical or dysplastic one, DN. Then maybe melanoma in situ, MIS, still confined to the top layer. Then it can enter the radial growth phase, spreading sideways. And after that, the really dangerous step, the vertical growth phase, growing downwards.
Which is the gateway to metastasis.
Exactly, leading eventually to metastatic melanoma spreading elsewhere in the body.
We know genes like BRAF, NRS, and TERT are involved, accumulating mutations along this path. But the paper's core message seems to be that the interaction with the STE is what really flips the switch.
That's the crux of it. The genetic mutations might start the fire, but it's how the environment fans the flames, how the ECM changes, how immune cells react. Which growth factors are around that determines if a mole just stays atypical or becomes a truly aggressive cancer. That benign to malignant transition heavily involves the STE.
Okay, let's zero in on two things the paper highlights in melanoma's STE, neoangiogenesis, and integrins. We touched on blood vessels earlier.
Right. So, as melanoma gets more advanced, especially moving towards that vertical growth phase, getting those new blood vessels is absolutely critical. The tumor is hungry. The STE orchestrates recruiting the endothelial cells to build them. But here's the twist. The STE often drives the formation of abnormal, leaky vessels.
Leaky vessels, that sounds bad for the tumor.
You'd think so, but actually those leaky, poorly formed vessels can make it easier for cancer cells to slip into the bloodstream and metastasize. It's a bit counterintuitive.
Okay, and then integrins, what role are they playing here? The paper calls them crucial mediators.
Think of integrins as, like, the cell's hands and feet, but also its communication devices on the surface. They let cells physically connect to their surroundings, especially that ECM scaffold. But they do more than just stick. They relay signals back and forth between the cell and the STE. They're vital for cell adhesion, movement, invasion. And they're also key players in driving that neoangiogenesis we just talked about.
And there's one specific integrin they focus on, alpha V beta 3.
Yes, alpha V beta 3. This one is often found at higher levels in tumors. It binds to a protein in the ECM called fibronectin. And the key finding highlight is that the activity of this alpha V beta 3 integrin seemed to peak in melanoma in situ and in lymph node metastasis.
So right at those critical points, early transformation and when it starts spreading.
Exactly. It suggests alpha V beta 3 activity is a really valuable marker, the kind of molecular signature indicating that early change, that stromal remodeling, and the angiogenesis kicking in, especially during that critical shift from radial to vertical growth. It's like a flag going up in the environment signaling danger.
Okay, so we have this growing understanding of the STE, these molecular signals, yet diagnosing melanoma reliably is still a major challenge. That seems frustrating.
It is incredibly frustrating. Melanoma is the deadliest skin cancer, but our diagnostics aren't perfect. A huge issue is overdiagnosis. The paper mentions staggering numbers like over 5 million biopsies a year in the U.S., but only maybe 100,000 actual melanomas found.
Wow. That's a lot of unnecessary procedures, anxiety, cost.
Absolutely. And then there's the flip side, the terrifying prospect of a false negative missing a melanoma when it's there, delaying treatment.
So what are the limitations of the current standard approach? Visual checks, dermoscopy.
Well, looking at a mole using the ABCD criteria or even a dermatoscope, it's subjective. It depends a lot on the clinician's skill. It can miss early subtle lesions or unusual ones. And fundamentally, it's just looking at the surface, the morphology. You can't see the molecular action underneath.
Even
Yeah,
biopsy, the histopathology can be ambiguous because it is subject to interpretation and the expertise of the pathologist.
Especially for those intermediate ambiguous moles. Pathologists looking at the same slide might disagree on whether it's severely atypical or truly early melanoma. The paper cites studies showing agreement rates or concordance can be pretty low for these tricky cases, maybe only 20–35%. That's not ideal.
Because traditional stains don't show those molecular or genetic changes we've been talking about.
Precisely. And while other methods are emerging,
like gene expression profiling.
Yes, GEP or immunohistochemistry, IHC. They give more molecular detail, improve accuracy, but they still need that invasive biopsy. Plus, they require specialized labs and cost. They aren't simple point-of-care tools. Other point-of-care things like RCM, OCT, AI apps, they show promise, but often still focus on refining morphology or have issues with cost or nailing those intermediate lesions. None are really imaging the active molecular process in the STE directly.
Which leads us neatly to the really exciting part. This new approach called skin fluorescent imaging, SFI. The paper frames molecular imaging as the best bet for truly seeing the STE in action based on a proof of concept study.
Right. Molecular imaging tries to visualize biological processes at the molecular level, and SFI is presented as a specific, non-invasive way to do that for melanoma. Its goal is to assess changes in integrin activity, specifically targeting that alpha V beta 3 integrin we discussed because its activity signals that tissue remodeling associated with melanoma development.
And it does this using a special fluorescent dye.
Exactly. They use something called the ORL1 dye. It's a fluorescent molecule attached to a small peptide, an RGD peptide. This RGD bit is designed to stick specifically to active alpha V beta 3 integrin. So the idea is, where you have high alpha V beta 3 activity in the tissue, the dye binds, and you can see it glow under a special light.
Letting the SFI imager visualize where that concerning remodeling is happening.
Precisely. In vivo, on the patient's skin.
And the actual process sounds pretty straightforward in the paper.
Yeah. It's described as relatively simple for clinical use. Apply the dye to the mole and surrounding skin. Wait about 5 minutes. Wipe off the excess. Then the SFI imager captures both a regular photo and a fluorescent image showing where the dye's stuck, showing the alpha V beta 3 activity.
And these images go into software for analysis.
Right, the OMA software. It calculates a score based on how much dye bound and where, essentially quantifying that integrin activity.
And they trained the software using biopsy results as the ground truth.
Correct. Histopathology was the gold standard. They fed the system biopsy-confirmed diagnoses to teach the algorithm which fluorescent patterns correspond to benign moles, which to dysplastic ones, and which to melanoma. So the score reflects the level of that alpha V beta 3 binding activity, which acts as a proxy for that dangerous tissue remodeling and angiogenesis.
And the results they reported from their data set sound, well, pretty impressive.
Very promising. They used a scoring system in machine learning, focusing on distinguishing concerning nevi that included melanoma, MIS, and severe dysplastic nevi from the rest. With a specific score cutoff, they reported achieving in their data set 100% sensitivity.
Meaning it caught all the melanomas and high-risk lesions?
Yes, and 95.7% specificity for telling melanoma apart from non-melanoma cases.
Wow. 100% sensitivity and over 95% specificity for those difficult lesions. That could be huge clinically. What's the potential impact?
Well, the idea isn't to replace visual checks or dermoscopy entirely, but to use SFI as an adjunctive tool, specifically for those atypical moles that leave clinicians uncertain. By getting an objective score based on this underlying molecular activity in the STE, it could potentially help doctors decide much more confidently which moles really need a biopsy.
Reducing those millions of unnecessary biopsies.
That's the hope. And enhancing clinical decision-making by providing information about tissue remodeling before it's obvious, just by looking at the mole shape or even under a standard microscope.
Because it's detecting that STE activity, that angiogenesis signal, linked to the radial growth phase and vertical growth phase transition potentially much earlier. It's looking at the environment's behavior.
Exactly. It's shifting focus from just the tumor cell's appearance to the signals coming from their surroundings, the STE.
So wrapping up this deep dive, it feels like our whole understanding of cancer is broadening. It's not just the rogue cells anymore. It's this intricate interplay with the stromal tumor environment.
Absolutely. Recognizing the environment isn't passive, it's an active driver of key cancer process.
And new technologies like SFI, by giving us a window into that environment, by detecting molecular signals like alpha V beta 3 activity, offer a potentially powerful new strategy. A way to spot trouble based on the environment's activity, maybe earlier and more accurately than we could before.
It really is a shift in perspective, moving beyond just looking at the house to checking out the whole neighborhood for signs of trouble.
Which leaves us with a final thought for you to consider. If imaging the tumor's environment can potentially transform how we diagnose skin cancer, how might this focus on the neighborhood change our approach to detecting, understanding, and maybe even treating other types of cancer, or perhaps even other diseases entirely down the road? What other critical hidden clues about disease might be lurking in the environment, just waiting for the right way to be seen?